If you have ever seen a blood pressure reading like 90/60, you might assume that is great news. But here is the problem. In some cases, low blood pressure can actually be dangerous. Today, I am going to show you exactly how to tell the difference between healthy low blood pressure and the kind that doctors worry about. I'm Dr. Mandy Thomas. Let's get into it. Comment dizzy below if you have ever felt lightheaded when standing up. I am curious how common this is. I read everyone. You have probably felt it at some point. You stand up quickly and suddenly the room tilts, your vision dims for a second, and you have to grip something to steady yourself. For some people this happens occasionally, for others it happens regularly. That sensation is your body telling you something about blood pressure, and by the end of this video you will know exactly what it means and what to do about it. What low blood pressure actually means. Blood pressure is the force your blood exerts against artery walls as your heart pumps it around your body. The top number, systolic, measures pressure when the heart is actively pumping. The bottom number, diastolic, measures pressure between beats when the heart is at rest. A reading around 120/80 is generally considered healthy for most adults. Low blood pressure, medically called hypotension, is generally defined as readings below 90/60. But here is the crucial point most people never hear. A low number on the cuff does not automatically mean something is wrong. Context matters enormously. That is what this entire video is about. When low blood pressure is a red flag, and here is where most people get confused about the distinction. Doctors think about blood pressure as a three-part system. How much fluid is circulating in your body, the tension and resistance in your blood vessels, and how effectively your heart is pumping. When any of those three systems malfunctions, pressure drops, and in some situations that drop is a serious signal. On the heart side, abnormal rhythms can cause low pressure. A heart beating too fast does not have enough time to fill properly between beats, so each pump delivers less blood. A heart beating dangerously slowly does not pump frequently enough to maintain pressure. Significant heart muscle damage from a heart attack can weaken the pumping force. Certain valve problems restrict blood flow. On the fluid side, serious bleeding, from trauma or internal sources, removes the volume that creates arterial pressure. Severe dehydration from prolonged vomiting, diarrhea, or simply not drinking enough does the same. A large blood clot in the lungs, called a pulmonary embolism, can interfere with blood flow in ways that produce dangerously low readings. There is also a nervous system category. The autonomic nervous system handles automatic functions like blood pressure regulation without conscious effort. In some neurological conditions, this system stops working properly, and the body loses its ability to maintain adequate pressure. Here is the most important point in this section. These serious causes are most concerning when low blood pressure represents a change from someone's normal baseline. If you have been sitting around 120/80 for years and suddenly you are reading 85/55, that drop is a signal worth investigating. It suggests something new has interfered with normal pressure regulation. That is a very different situation from someone who has simply always run low. When low blood pressure is completely normal. And this is where most people watching this actually fall. I see this regularly in clinic. A patient in her late 60s comes in worried because her reading is 88/62. She looked it up, saw the word hypotension, and assumed something was wrong. But when we go through her history, no symptoms, no dizziness, no recent changes, the reality is that this has simply always been her blood pressure. She is active, healthy, and her heart is doing exactly what it should. That number is not a problem. It is her normal. Low blood pressure is extremely common in lean, active individuals, and particularly common in women. Many individuals walk around with readings in the range of 85/90/60 or 70 and feel completely fine. They are active, healthy, and going about daily life without any issues. For them, low blood pressure is simply their normal. Not every body is calibrated to the same specifications. Some people naturally run warmer. Some have slower resting heart rates. Some have lower blood pressure. If that is simply how your body has always operated and you have no symptoms, there is genuinely not much to worry about. The challenge is that naturally low blood pressure leaves less room for additional drops before symptoms appear, like a car already running close to empty. Relatively minor things like mild dehydration, heat, intense exercise, or standing up quickly can be enough to cause a noticeable further drop. The most common symptom is that lightheaded, slightly woozy feeling when the brain is not receiving quite enough blood flow. In more pronounced cases, some people faint briefly. Standing up suddenly is a classic trigger, and there is a specific term for it: orthostatic hypotension, where blood pressure drops upon standing because blood pools briefly in the lower body before the system compensates. Here is a concept worth knowing: the J curve. Picture a J shape where the horizontal axis is blood pressure and the vertical axis is risk. As blood pressure rises, risk increases sharply, which is why hypertension gets so much attention. But risk does not drop to zero as blood pressure gets lower. At a certain point on the low end, risk starts to creep back up, forming the bottom curve of that J. Both extremes carry risk. The goal is not to drive blood pressure as low as possible. It is to be in a healthy range that works for your body. Now I want to pause. Every week I break down one cardiovascular topic that directly affects heart health after 60. Subscribe right now and turn on notifications if you want science-based guidance you can actually use. And share this today with a senior you care about who has been confused about their blood pressure readings. How to tell which category you fall into. The most important factor is symptoms. If your blood pressure reads low, you feel completely fine, you have no dizziness or episodes of fainting, and this has always been your pattern, you can generally breathe easy. But if you are experiencing symptoms, or if you have noticed a change from your historical baseline, that is when a conversation with your doctor is warranted. When a doctor evaluates low blood pressure, they take a thorough history and do a physical examination. In many straightforward cases, especially young people with chronically low but stable readings, that history and examination is enough to determine nothing serious is going on. More extensive testing may not be necessary, though your doctor will make that determination based on your specific situation. But there is one situation where low blood pressure fools a lot of people, including doctors, and it is worth spending a moment on specifically. One scenario that deserves special attention. Imagine someone who has had normal or slightly elevated blood pressure their whole life, perhaps managing mild hypertension. They get a reading of 90/60 and their first reaction is relief. Finally, the numbers are down. But if blood pressure has historically been higher and is now reading low, that is not necessarily cause for celebration. It could indicate a medication dose needs adjusting, or something else is happening physiologically. An unexplained significant change in blood pressure, in either direction, deserves evaluation. What to do if low blood pressure is causing symptoms, and some of these will surprise you. There are practical, effective steps that genuinely help. Stay well hydrated. This seems almost too simple, but it is highly effective. Maintaining adequate fluid intake keeps blood volume up, which directly supports blood pressure. During warmer months, during exercise, and in hot environments, fluid needs increase, and not keeping pace is one of the most common reasons people with naturally low blood pressure become symptomatic. Electrolyte-containing beverages are also useful. Sports drinks containing sodium, potassium, and other electrolytes help the body retain fluid more effectively. One per day during periods of increased activity or heat can make a noticeable difference. Here is something you almost never hear in a doctor's office. People with genuinely low blood pressure can be told to be more liberal with salt. While most health advice focuses on reducing sodium, rightly so for people with high blood pressure or cardiovascular risk, the calculation is entirely different here. Salt causes the body to retain water, which increases blood volume, which raises blood pressure. Chicken broth, soups with sodium content, and salty snacks can actually be beneficial in this specific context. This advice applies specifically to people with confirmed low blood pressure. It is not general dietary advice for everyone. Be mindful of how quickly you change positions. If you are prone to dizziness when standing, do it more gradually. Sit on the edge of the bed for a moment before fully standing. Give your cardiovascular system a few seconds to adjust. This simple habit can significantly reduce lightheaded episodes. Compression stockings are another option. They apply gentle pressure to the legs and lower body, which helps prevent blood from pooling in the lower extremities when you stand. If orthostatic hypotension is a regular problem, it is worth discussing with your doctor. Know your triggers. Hot weather, prolonged standing, skipping meals, alcohol, and intense exercise can all contribute to drops in blood pressure. Being aware of them helps you take preventive steps. Staying well hydrated before exercise in the heat, having a snack before a long event where you will be standing. A note on older adults specifically. While younger people with low blood pressure generally tolerate it well, older individuals can be more vulnerable, and this is the part that surprises most patients when I explain it. I had a patient in her late 70s whose family brought her in after her third unexplained fall in 2 months. Nobody had connected the falls to her blood pressure. When we checked her readings and had her stand up slowly while monitoring, her pressure was dropping 25 points every time she rose from sitting. Orthostatic hypotension. Her medication dose had been increased 6 months earlier, right around when the falls began. We adjusted the medication, added compression stockings, and worked on her hydration. The falls stopped. Blood pressure regulation becomes less efficient with age, making this pattern more common and the consequences more serious. Falls in older adults are not a minor nuisance. They are a genuine health risk. If an elderly parent or family member has had unexplained falls or seems dizzy regularly, low blood pressure is worth investigating with their doctor. A note on medications. Here is something most people do not think to connect. Many medications can cause low blood pressure as a side effect. Blood pressure medications are the most obvious, particularly if a dose is too high or multiple agents are combined. But certain antidepressants, Parkinson's medications, some diuretics, and erectile dysfunction medications can all lower blood pressure. I see this regularly. A patient starts a new medication and 6 weeks later mentions in passing that they have been feeling lightheaded in the mornings. The timing is the clue. If you started a new medication and began noticing low blood pressure symptoms around the same time, flag it with your prescribing doctor. It is often a straightforward fix. I've put together a free low blood pressure action guide, a 1-page printable I give my clinic patients that covers the warning signs that warrant a doctor visit, hydration strategies that actually work, and exactly when to see a doctor. Print it and keep it somewhere useful. The link is in the description. Drop a comment below. Comment dizzy if you have experienced lightheadedness when standing, or tell me which of these strategies you are going to try first. I read everyone. Every week I break down one heart health topic that doctors wish more people understood. Subscribe if you haven't, and share this with a senior you care about who has been confused about their blood pressure readings. Next video. 3 natural interventions shown in clinical trials to lower blood pressure, sometimes by as much as medication. One of them works in under 2 weeks. I'll see you there. This video is for educational purposes only and does not constitute medical advice. Always consult your healthcare provider before making changes to your diet, medications, or health routine, especially if you are experiencing symptoms or if your blood pressure readings have changed.